Jean is an expert on privacy and health information privacy in the UK and the European Union. And so I'm going to now turn it over to Jean to give us the view from across the Atlantic.
Well, thank you very much for inviting me to this very, very fascinating and important webinar here today. I'm going to look at some of the issues to do with COVID digital certificates which have been introduced by the EU itself. And this is a relatively new measure that's actually come in and is being bedded in now by member states across the EU. So some of this is a case of really how it wait and see it to a certain extent how it's actually going to operate. But I'm going to provide an overview really of where we've got to up until now and how this will operate. The backdrop to this really can be seen in some ways as the tensions really at the start of the pandemic between, on the one hand, principles of free movement, which are integral in the EU treaties themselves, and at the same time, the concerns of questions of public health. Free movement can be limited on public health grounds. Now, those sort of tensions have been right there really from the start, and also have to be seen as well in relation to the economic considerations that, of course, underpin quite often a lot of the discussions around vaccine and stroke other related passports themselves. Now, this also has to be seen in the context as well of privacy. And of course, the EU has this writ large, both in terms of the EU Charter of Fundamental Rights, and as well in the GDPR, the General Data Protection Regulation, which roots privacy in terms of a principled approach, lawfulness, fairness, data minimization, accuracy, limitation on storage, integrity of confidentiality, transparency, and so on. Now, the EU itself has adopted a regulation, 2021/953, in relation to verifying COVID certificates. And these are not just simply concerning vaccinations, they're also concerning testing and recovery. And as I said, this is in the phase-in period at the present time. And in many ways, the aim of this measure is to try and put in place something which can be seen as proportionate and be in line with principles of non-discrimination and balancing out public health too. Now, the certificate itself is free. It can be issued in digital or in paper format, and it will be issued at a national level by designated national authorities themselves. So member states will make citizens aware of how they can access it. It will be in the individual's language, national language, and also in English, and valid across all EU member states. Now, as I said, it relates to vaccinations, to negative tests, and also to certificate of recovery. And of course, this is seen as particularly important, bearing in mind the problems of going ahead with a simple, in inverted commas, simple vaccination certificate on its own, with the implications of that, bearing in mind that the vaccine programme, although it's rolling ahead across the EU, it's by no means totally comprehensive at the present time. And of course, some individuals may indeed not be able to access vaccines for medical or other reasons. The member states themselves have to accept currently vaccines approved by the European Medicines Agency, and there are 4 of those which are up there on the table at the present time. And as well as that, member states can issue certificates in relation to vaccinations where citizens themselves have been given vaccines outside the EU. There's a current discussion about that in the context of Irish citizens who were vaccinated in the US. Now, secondly, negative test results, and there's a standard validity period for both PCR tests and rapid antigen tests that have been recognised. And the aim here again is that those people will be exempt, but as we'll see, there may be some situations where, as with this, as with the other requirements, the member states may put other limitations on. The the certificate itself too also relates to recovery from infection and confirms that in a situation if somebody's had the illness, then the recovery certificate can be issued as well. The digital COVID certificate does not actually, though, also apply to antibody tests. There was discussion around that, but those are also seen as problematic at the present time in terms of reliability. Now, there are key features here. And first of all, it operates via QR code. The aim is to ensure that only essential information itself is transferred itself. And it's the issuing body that has the digital signature that's verified when the QR code itself is scanned. And this is using information, the gateway provided by the European Commission. Now, as I said, it's limited information that is contained on the certificates themselves, about vaccines, recovery, etc. And critically as well, this information is retained on the certificate, so it's not passed on to other member states. Again, of course, issues here around maintaining confidentiality. At the backdrop to this, of course, is the question of trust, and indeed IT trust frameworks that are safe and secure, enabling the issue and verification of this. And the EU has been working with member states on this. Also, the aim as well of working alongside data protection principles. Questions around here of minimal processing information, only in terms of facilitating free movement. And in a sense, this is the thing about the certificate. It's aiming to facilitate movement, something guaranteed to EU citizens. Personal data is limited to that that's strictly necessary. And one thing that, interestingly, the actual regulation doesn't state who is the data controller on this. There's a suggestion when EU data protection bodies looked at the draft regulations that this should be included. It wasn't ultimately. Some concerns that are still out there remain, and this has been an issue about certificate tests in relation to COVID testing already in different EU member states, the concerns around data security and the prospect of forgery and sale of them. The data is to be processed, within the EU itself. There is no central EU database here of health information in this way. I mean, the EU is moving in other situations, in other contexts, towards the prospect of an EU transfer of EU health data across member states. But here, this is utilising information in a limited extent only for certain purposes itself. Now, the regulation, though, is not forever. It's only applying for 12 months after it comes into effect. And there's also use of data as well for other purposes, such as criminal investigations, which have also raised concern about privacy and questions too. There's already been some agreements made with other non-EU countries in going ahead for use of the digital pass. Now, it is the case, as said, that this is to facilitate free movement, and you can travel, but some travel restrictions, additional ones, can be imposed under the regulation if they're needed and proportionate to safeguard public health. For example, the rise of variants of concern that might evade, vaccines, and so on. Now, there's an emergency brake mechanism, therefore, in the regulation, which allows member states to impose additional restrictions, giving at least, where possible, at least 48 hours notice actually about that. So, and this in some ways is recognising, and I think that, again, as Meryl's indicated in the first presentation too, that there are so many uncertainties still, of course, around questions of resilience of vaccines themselves going forward, and also indeed in uncertainties around infection. So going forward, it's about streamlining consistency. It's not a vaccine passport as such. There are concerns, though, about aspects of it. And again, there's questions of long-term relationship of transfer of health information. But it's interesting to contrast the approach. And I'll just leave you with two quotes, really. One from the recital to the regulation itself. that those restrictions should be put in place should be lifted as soon as the epidemiological situation allows. And compare that in what used to be an EU member state until not that long ago, the UK. Grant Shapps this morning, the Secretary of State for Transport in my country, who suggested perhaps that double vaccination and maybe a feature forevermore in this context. Thank you.